Welcome again. A 44-year-old woman with widespread pain, fatigue, and insomnia presents to the healthcare provider's office with complaints of excessive fatigue and tenderness over several body points. The patient noted that she developed chronic widespread pain and fatigue following a routine gynecological surgery to treat endometriosis 4 years back. Other medical history includes GERD, gastroesophageal reflux disease, migraine headache, and hypothyroidism. Alert and oriented, deep tendon reflexes +2. Client has a BMI of 28. Tender points noted in neck, shoulders, elbows, and knees. No redness, warmth, or swelling present. Vital signs, temperature 97.8, pulse is 70, respiration is 18, and blood pressure is 122/86. So we have been given this scenario, and now the question is going to be, when you look at the question, it's going to say, in a bow tie format. So the question is, like, you will have the condition most likely experiencing. So from here, you will have to put it there. What is the condition? And then what are the two actions or things which you might expect for this client? So we have to put two of them there. And what are the parameters to monitor? So that will be two of them there. And this is the options which we have. So always when you get a bow tie question, you always have to start from the middle. We'll have to figure out what is the condition, because once you know what is the condition, then the other things you can, it's easy because you can connect it, and we will know if this is the condition, this is what most probably we are going to do, kind of thing. We're going to go back to the previous slide, and we are going to go through the scenarios which are listed there and see if there is any clues which we can figure out. Okay, so the four options you have right now is rheumatoid arthritis, osteoarthritis, Graves' disease, fibromyalgia. So the ones which I have colored, those are your clues, main clues, which help you to decide, because we need to make the decision based on the information given. And we should also know how to eliminate the distractions. Now, there is a distraction here. They talked about some GI problem. They talked about migraine headache. They talked about hypothyroidism, right? And they talked about the client has a BMI of 28. I mean, with hypothyroidism, that's probably something which might happen, because we know the weight gain is part of hypothyroidism. And we don't know if she's taking any medications or anything. We don't have any information yet. But what we know is this is not an acute problem. The patient had this chronic, widespread pain, and it's been there almost for 4 years. And this is another distraction about endometriosis. This patient is having widespread pain, and we know that there is tender points in neck and shoulders, the elbows and knees. So when you have neck, shoulders, elbows, knees, those areas are tender points. Tender points meaning they hurt. I mean, those are the areas which hurt, and that is very, very specific to fibromyalgia. And we know this is not rheumatoid arthritis because, or osteoarthritis or anything like that, because there is no inflammation. No redness, no warmth, no swelling. So usually, joints get inflamed in rheumatoid arthritis kind of issue, and there will be like this autoimmune problems which can happen. But here, there is nothing like that. It's just pain and fatigue. And her vital signs, there is nothing really bad there, right? So there is no infection going on. So it's not like osteomyelitis or anything. And in osteoarthritis, we know that there is like bony prominences, and there is this deformities and nodes and things which can come. That is also not there. Eliminate that rheumatoid and osteo kind of problems, because it doesn't seem like a muscular, skeletal, inflammatory kind of issue, right? So that's why we can eliminate those two. Now, Graves' disease, is that a possibility for this client? No, Graves' disease is more towards hyperthyroidism. It can happen in both, but it's more happening in hyperthyroidism, right? And Graves' disease will have more signs and symptoms which we might see, but it doesn't say here. And yes, she has hypothyroidism, not hyper. And how about this one, the deep tendon reflexes +2? Is that okay? That is normal. Yeah, that is normal. So that was another distraction. Now, another clue is it's not just the pain. In fibromyalgia, you will have associated problems too, like fatigue, insomnia. Sleep problems are something which is really, really like a combination in fibromyalgia clients. Okay, and these are the tender points. And in the immunology class, I have shown this slide. So you might have already seen this before. So now that we decided that this is fibromyalgia, what would you say about this part, the actions to take? What would be your answers there? Initiate steroid therapy, initiate methotrexate, increase levothyroxine dose, initiate amitriptyline, and the last one, muscle strengthening exercise. So what are the two things you would expect for this client to have if we know this is fibromyalgia? I mean, I think at least we can eliminate this, right? Because we know it's not the thyroid problem. So basically 3 is out of the 4 and 5, 1 and 5. All right, let's see. In your notes, if you look at your fibromyalgia notes, which you have, it says here in the first one too, the treatment. Somebody has this neuropathic or widespread kind of pain. Antidepressants are actually helpful. They are one of the things which we will use. Steroids, probably not yet. It depends, because remember, what does steroid do? I mean, I know some of you said steroid, but what is a steroid? It's anti-inflammatory, right? That is the steroid job, anti-inflammatory. It is immunosuppressive too, but the major action of a steroid is anti-inflammatory. Did we say this client is having inflammation? What did we say? There is no inflammation, right? There was no redness, no swelling, there was no infection, there was no fever. So do we really need steroid? And on top of that, steroids are a lot of side effects and things, right? So do we need steroids for this client? Probably not. If it was rheumatoid arthritis, and you know, it's an autoimmune problem, and we know what is our go-to medication when there is an autoimmune issue, right? We go for steroids. So if it was rheumatoid arthritis, I would have said this might have been useful. I would also might have said methotrexate, because methotrexate is also something which we might use for rheumatoid arthritis. So these two are not going to be our answers for this question because it's fibromyalgia. Now, we know it's not 1, 2, or 3, right? So what is the next options we have? Initiate amitriptyline. Amitriptyline is, like I said, a medication which can be used for fibromyalgia, which is really helpful. So that is something which we might see. And of course, muscle strengthening exercise, because when someone is having fatigue, widespread pain in all these joint areas, they may tend to sit down or they may tend to lie down. And we know what happens then, right? When you are not using the muscle because of pain or fatigue or whatever reason, if you are not moving, if you're not doing at least some exercise, the muscles are going to wither away. The muscles will lose its strength. So it's going to get worse and worse and worse. Probably they're going to deteriorate more, and it is going to affect them. So what is something we can encourage them to do? Muscle strengthening exercise, little by little, with proper rest periods in between, because they're fatigued and it's painful, but they need to keep their muscles working. It's important on the long term. So our answers for this one is going to be 4 and 5. Okay, now let's go to the other side. Parameters to monitor. So we have activity tolerance, vital signs, daily weight, pain rating, and urine output. What would you say? Okay, very good, very good. A and D. So activity tolerance, because if the patient is activity tolerance, meaning how much can they do? Like they were not able to walk, now they can walk more, or they were not able to do any household chores, now they can do more, or they were not able to drive because of the pain, now they are driving. So it's like how much activity can they do without any problem? So activity tolerance is definitely going to tell us whether they are improving or not. And it may take time, because we know all these kind of medications, especially psychiatric medications or something like that, it takes time. So do not expect the client to be like immediately getting up and going on the second day or third day, not happening, right? So they have to keep going, but it's helpful. So activity tolerance, and this one, the pain, because the major problem in fibromyalgia, algia is pain. So fibro is like, the fibrous stuff or the muscle stuff. So myo is muscle. So myalgia is muscle pain. So obviously, if the pain is something which they can tell us, how bad their pain is now or how much it improved, that is going to help us kind of see if the effectiveness of the medications or whatever effort we have done for this client. Now, I just want to add on to this, this part. Another thing which you might see is self-care. We need to encourage the clients about self-care and sleep hygiene. Okay. We have talked about the sleep hygiene and healthy diet and all those, good habits for life. Those things are also something which we can focus